This conference will now be recorded.
On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, my name is Ethan Baldwin, and I welcome you to this public hearing to discuss the Division's preliminary rate decisions for 2022 health benefit plans. The Division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the Division's preliminary decision and final objections regarding the filing. During this time, carriers will be permitted to defend their assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. When reviewing a rate request, Division actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios, that is, how much of every premium dollar goes to pay healthcare claims costs. This is to ensure the requested rate is not projected to trigger federal rebates or payments from other federal programs. Division actuaries also look at the recent history of rate changes and the overall financial strength. The overall financial strength, including profitability, investment income, and surplus of the company, as well as administrative costs. Division staff also ensure that the filings meet all requirements of the Affordable Care Act and determine whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate request for all of these companies at our website, www.oregonhealthrates.org. All communication for every health insurance rate change filing, including written answers to all questions asked during the review period, are posted there as well. In this hearing, we are discussing in this order the preliminary rate decisions the Division has made on individual and small group health benefit plans filed by Moda Health Plan, Inc. and PacificSourceHealth Plans. Our agenda for this morning will be representatives from each company making a presentation and describing their requests. Then Division staff will lead a discussion about the Division's preliminary decision on each filing. Finally, we will accept public testimony. If you'd like to comment on a company's filing, please unmute, introduce yourself, and make your comment. Comments will also be accepted online through 11:59 p.m. on July 7th. The Division will make a final decision about these rate filings shortly after that public comment period ends on July 7th. Moda, please begin by introducing yourself and explaining your rate request.
Hi, this is Mark Danberg-Wild, Director of Actuarial and Underwriting for Moda Health Plan. I'm going to be having Ajmal Hasib and Alex Vanos doing most of the speaking through the presentation here. I'll let them each introduce themselves.
Hi, my name is Ajmal Hasib, Actuarial Supervisor at Moda Health Plan, and I work primarily on the individual rate filings.
Hi, Alex Vanos, Actuarial Supervisor here at Moda, primarily involved in the small group rate filing.
Hello, this is Craig Anderson. I'm the Chief Actuary at Moda.
Thank you, and I'll get started with our individual rate filing. As a high-level summary, Moda initially filed an average rate increase of 2.6%, which ranged from a decrease of 0.3% and an increase of 4.7%. Through the rate review process, this was slightly modified down to an average increase of 2.5%. This rate increase impacts around 33,500 members, which is our enrollment as of March 2021. Factors that have been revised since the previous filing have been our area factors as well as our silver load. This map shows an overview of what our service area currently looks like for our individual line of business. The plum represents our beacon network and the aqua represents our affinity network. In 2022, we'll be offering a total of 29 plans. The distribution of these plans by network and metal are shown in these bullet points below. Most of all of our plans will be offered both on and off the exchange. Certain silver plans will be offered off exchange only directly through our website. Speaking to our provider network, no major changes are anticipated in 2022 for Moda's individual networks. Consumers who do wish to provide feedback about our network can do so by contacting our customer service department. Alternatively, we also have a provider nomination process available on our website. Speaking of plan changes going into 2022, we have a number of new plans, primarily those off exchange only silver plans, as shown on this table. No plans from 2021 will be discontinued going into 2022. Speaking of our existing plans, this kind of shows a summary of all the changes that have or will be made to our plans in 2022 for our existing plans. With respect to our prescription drug formulary, no major changes are anticipated for our formulary in 2022. With prescription drug costs and the impact of it on our rates, in terms of our total claim spend that we expect for 2022, about 22% of that is expected to be on prescription drug costs for our individual members. And that's individual. I'll kick it over to Alex for small group.
Thanks, Ajmal. So looking at a high-level rate filing summary, our filed average rate increase was 3.4%, and there was no changes in the review process. So the preliminary decision is at that 3.4%. The minimum is a 9.6% rate decrease, maximum of a 9.6% rate increase. Those numbers reflect mapping, crosswalking members that were on plans that were discontinued. So we did map those to the closest substitute for 2022. As of March 2021, this impacts 6,191 small group members. Factors that have been revised since the previous filing, we revised our area factors and then also revised trend in the quarterly increase that we apply to rates. Looking at our 2022 portfolio, consists of 31 plans, 4 platinum, 10 gold, 11 silver, and 6 bronze. 2 networks are being offered. So we have our Connexus network, which is available statewide, and then our new Moda Select network, which is only available in rating area 1. In terms of network changes, no major changes are anticipated in 2022 for our existing small group networks. Consumers who wish to provide feedback about our network can do so by contacting customer service. And then alternatively, Moda Health has a provider nomination process available on our website. Looking at new and discontinued plans, so over on the right there, you can see the synergy plans that we are discontinuing for 2021. And then on the left, you can see all of the new plans that we're offering is that new Moda Select network with plans in all metal levels from platinum to bronze. And then for existing plans, so on our Connexus plans, no benefit changes for 2022. And then the Oregon standard plans that we offer were updated to match what the DFR puts out there. In terms of anticipated formulary changes, no major changes are anticipated for Moda's formulary in 2022. And then in terms of the impact of prescription drug costs on rates, our projected allowed dollars for 2022, of that, 18% is anticipated to be due to prescription drug costs. And that's last slide for Moda.
Thank you. Division staff will now lead a discussion about the division's review of the filings and preliminary decision.
Hi, my name is Drew Bucks. I was the primary reviewer for the individual and small group Moda filings.
Hi, I'm Tasha Sizemore. I'm the Life and Health Program Manager for the division.
And I'm Michael Sink, the secondary reviewer for this filing.
Okay, so I'll talk a little bit about today the process that we go through here at DFR to review the filing and determine if the rate request is reasonable. On a high level, the CERT filing has lots of documents that are included, and some of the ones that we focus in on are the actual memorandum, the exhibits, the financial statements, and we have some standard review questions. Focusing a little bit more on the memo and the exhibits, the basis for this rate request starts in the 2020 experience and factors, and that's how using those to create the 2022 rates that we have in front of us. And our job is to focus on the experience that's used, the factors and assumptions, and the calculations again to get to 2022. So we reviewed those in total, and we've had objections and responses and reviewed those as well, and find everything there to be reasonable. I'll talk a little bit more about the factors and assumptions for this filing, starting off with one that's unique to this year, what we're calling a COVID rebound factor. So for the 2020 experience, there was a low medical utilization due to the COVID virus. So we review the company in response to this is including a factor to show what the 2022 rates will, the impact of those of the low utilization. We reviewed the factor of 5.8%, the development of the factor, and we asked for supporting information from the company and found both the factor itself, the development, and their responses to be reasonable. And we also compare this factor to the market as a whole to determine if the company is an outlier, if there's anything going on there. So, and again, that was reasonable. Moving on to a couple of the other more rudimentary factors that we see every year, trends, reinsurance, and risk adjustment. So for trend, this is used to project the medical inflation and utilization from 2020 to 2022. And Moda uses a 6% factor, which was within the range of other carriers, and the development themselves was, again, to be found reasonable. Moving on to reinsurance, and this only affects the individual market. We added up the amounts projected from all of the carriers, and it was in line with our projections. So there was no issues with Moda's projection there. For risk adjustment, this information was just released from CMS recently, so we're still going through that. But I'm going to open it up to the company right now and ask them if they've had a chance to review what the risk adjustment was provided for, and if you guys anticipate any changes.
During our initial review, we didn't notice anything, or we don't have anything to bring currently at this time, but we will continue to review and we will let you know if we do anticipate any changes.
Okay, great. And we'll probably send out a market-wide objection, and you guys can let us know what your response is for that. So that's the review that we've done for the individual filing. We are proposing to approve as modified. There was a slight modification due to an insulin bill 2623, I think it was. And so the rate request went down 0.1%. I'll pause a second for questions. If not, then we can move on to the small group filing.
We would like to thank the division for taking the time to review our filing, and yeah, we really appreciate your time on this. Thank you.
Sure. And so moving on to the small group filing, a lot of what I'll say here is very similar to the individual filing itself, the only difference being reinsurance, like I've mentioned. So for small group, we reviewed the 2020 experience, the factors and assumptions that were used, and the calculations to produce the 2022 rates, and we found those to be reasonable. There was a COVID rebound factor that was used due to the low utilization in 2020, and it was slightly different than the individual factor, but we asked for supporting information and found it to be reasonable. The medical trend that was used for the small group was slightly less than the individual factor, but it was again comparable to other carriers for the small group market and was again reasonable. And then risk adjustment, I'll ask the same question, Alex. Have you guys had a chance to review the risk adjustment numbers and have any notes at this time?
I guess same answer. Have done a preliminary review and no anticipated changes.
Okay, great. Well, again, we'll look out for an objection, and you can let us know if you do find any changes. So for the reasons that I just talked about, we're proposing to approve this filing. And if anyone has any questions on this filing, please feel free to do so. If not, I'll pass it back to Ethan.
Thank you. Moda, do you have any additional information or comments you'd like to make at this time?
None for me, thank you.
Great. We will now
for me either. Sorry.
Sorry, thank you. We will now take any public testimony. Please unmute and introduce yourself. All right, sounds like no one has signed up to testify, so let me remind anyone listening that July 7th is the last day for public comments. They can be submitted through our website, www.oregonhealthrates.org. Next, we'll hear from PacificSource. We will pause briefly. PacificSource, please begin by introducing yourselves and explaining your rate request.
Hi, I'm Clara Combs. I'm the Director of Commercial Pricing, and I'm joined by Darcy Pesco-Felito, the Director of Commercial Programs. So I'll be going through an overview of our rate request for both individual and small group, and then I'll hand it off to Darcy to talk a little bit more about our product and network changes. Next slide, please. Yep, next slide, thank you. In our individual rate request, we're looking at a 1.2% year-over-year increase with impacts ranging from about -13% to +11%. This will impact about 26,000 members that we currently insure in Oregon. The range of this rate increase is driven primarily by changes in our geographic factors as well as our plan relativities. Within that, I think it's important to point out part of that is the changes to the silver load. For the first year, in previous years, silver loads were applied to all silver plans. Starting in 2022, only exchange plans will have that load, and we'll be offering some new direct-only plans that don't have the load. And so that's part of the driver of the increase, that direct-only members might see this premium relief from the removal of the silver load. The one revision we had since originally filing was related to the insulin capping bill. The premium impacts related to that cap are pretty minor as far as direct impacts go. It did, however, have a trickle-down requirement that the bronze deductible and out-of-pocket had to be made slightly later. And so our revised filing and the 1.2% increase shown here reflects that updated benefits and pricing for the bronze plan. Next slide, please. On the small group side, we were filing an average 2.8% year-over-year increase. Those range from -13% to +11%. And again, that's largely driven, that'll vary by changes in geographic factors, and it will have changes on a plan-by-plan basis, though the silver loading changes in the individual filing don't apply here. It will impact about 10,000 members And we do file rates through the entire calendar year, and we have a scheduled quarterly trend of 1.5% increase. However, that's just a measure how rate tables change each quarter. What our groups will actually experience at renewal is that 2.8% increase described above. And similar to individual, we didn't directly change rates in response to the insulin capping bill. It has a pretty minor premium impact. However, it did have that trickle down impact requiring changes to the standard bronze deductible. So this filing reflects revised pricing for the standard bronze plan as well. With that, I'll hand it off to Darcy to talk a little bit more about our product and network changes.
Thanks, Clara. So one of the things that we're looking at in the state of Oregon is our Navigator Expansion. So currently we offer our Navigator product in the Portland Tri-County area and also Central Oregon. And in 2022, we're pretty excited to be able to offer that on a statewide basis for both our individual and small employer groups. Next slide, please. So as we look at this opportunity, we've been looking at improving and providing greater access with some additional provider partners. So as part of this Navigator expansion, we'll be able to consolidate our current network and product offerings. So our Smart Choice product that we offer today in both the individual and small group market, those members and groups will be mapped to our equivalent Navigator product. Same goes with our Pathfinder product that is currently offered in the Portland marketplace. We'll be transitioning and mapping those members and small employer groups over to our Navigator product 1/1/2022 upon renewal. And then with Voyager, which is our current statewide PPO product, we will continue offering that network and product in a few counties, Baker, Douglas, Jackson, Josephine, and Malheur counties. All other counties, we will be mapping those members over to Navigator as part of our network simplification efforts. Next slide, please. Some of the updates that have already occurred, the Portland Clinic was added to our Navigator network March of this year. We have some additional negotiations currently going on that will be ready and available for our members 1/1/2022. And if we ever hear from any of our members, consumers, that there are additional provider partners that we should be looking at and contracting with, we would love to have the feedback using either our phone number or customer service because we always are looking to expand access for our members. Next slide, please. We have just a few small plan and benefit updates in the individual market. We're going to be adding new silver plans, 3 of them, to our direct only purchasers. Deductibles ranging from $2,900 to $3,900. We will be changing and adding the acupuncture chiropractic care benefit, which we currently have is $1,000 per year to the 12 visits and 20 visits annually. The insulin cap members, the cost share will be no more than $75 per 30-day supply. And one final change that we'll be making that we're pretty excited about is our telehealth, telehealth, teledoc copay. We're going to make that a standard benefit of a $0 copay on our non-HSA qualified plans on the non-standard PacificSource plans. Next slide, please. And 2 bits of technology that'll be coming our way for 1/1/2022 is an online chat feature and also an enhanced consumer shopping experience. So we're quite excited about those bits of technology that we'll be bringing to the market, and those will be available soon. Next slide.
So for our pharmacy drug list changes, we don't anticipate any major changes for 2022. The formulary is evaluated on a monthly basis, and so here I've listed just a few of the recent more notable additions and deletions to our formulary, but it is continuously updated and monitored as new drugs hit the market so that we're ensuring members have access to safe and cost-effective medications. We do employ utilization management to help control the cost of drugs. However, we're not planning on any major changes to this process for 2022. And we'll also comment that most drugs, any prior authorization set their quantity limits. Those are set at the time the drug comes on the formulary. And so for a specific drug in a given year, these things are not subject to a lot of change generally. Next slide, please. And finally, I'll comment on the prescription drug impact on rates. In the slide, we're trying to illustrate in 2020, pharmacy expense made up about, in both of our filings, about 18% of the total claims. And we do expect pharmacy trend to grow at a quite a bit faster rate than medical. So we're projecting that pharmacy claims will grow at a rate of about 10% per year. This double-digit trend is in line with national trend surveys as well as information from our PBM. It's especially driven by specialty drugs and new drugs hitting the market. So with that faster growth on pharmacy, we expect for 2022, pharmacy claims will grow to being about 20% of our total claims expense, which would be equivalent to 17% of premium. And that concludes our presentation. Thank you for the time to discuss the filing, and happy to answer questions.
Thank you. Staff will now lead a discussion about the division's review of the filings and preliminary decision.
Hi, my name is Michael Sink, Senior Life and Health Actuary and Primary Reviewer of this filing.
Hi, my name is Tasha Sizemore. I'm the Life and Health Program Manager for DFR.
And my name is Drew Bucks. I was the Secondary Reviewer.
Okay, let's get started. So I'm going to start by discussing the individual filing. There's a lot of similarities between individual and small group, a few additional components for individual. So when I get to small group, I'll just be talking about the minor differences between the filings. To start, I'd like to talk about the three main components that we review in every single filing. These main components, broad categories, are the data that goes into the filing, the raw claims and premium data that goes into the filing, which includes the approved increases for 2021, which are already in effect, and the claims from 2020. For this particular rate filing season, we're also taking a look at the impact that the COVID has had on the rates and the raw data in 2020, and how that is adjusted for in the filing, predominantly by using data that's available in 2019 as well. So when we talk about 2020, we will be talking about the COVID portion of the data. Now, the second part that we look at in the filing is the assumptions that go into the filing. These are the predictions, the estimates of what's going to happen between the base period of 2020 and the filing year of 2022. So this is a 2-year projection. And when we talk about some adjustments, we'll be talking about the differences of whether they are a one-time adjustment or if they are applied annually. This is the predominant area where we do our review because these numbers account for most of the changes within the filing. There's a little bit based on the data and a lot based on the assumptions. The final thing we look at is calculations to get from step A, point A to point B. Did they use the correct actuarially sound calculations to get to the projected and requested increases? In this particular filing, we found no issues with the calculations, so I will just mention that we do check these, and this year it's not going to be applicable to this particular filing. So starting with the assumptions, because this is the predominant or the driving factor of rate increases, as is true for anybody who's been watching these years after year, the number one factor driving rates is trend. And when we talk about trend, we're talking about inflation, we're talking about people using more services from year to year, and this comes up with a trend number. And for the company, they used a trend number of 4.7% for the individual products, and this trend is on the allowed basis. They also had an additional leveraging component that brought the overall trend to 6%. When we took a look at this, we took a look at it based on historical trends with PacificSource. We took a look at the market trends for the company. 4.7% is in line and in the middle of the pack of all the carriers who requested filings, requested increases and decreases this year, with ranges from 2.5% at the low and 6% at the high. We look at everything at an allowed basis because only some carriers use a paid basis calculation, others use the allowed basis calculation. So we did not have any concerns with this trend calculation. It is applied twice in the filing. So when we talk about 4.7, that is applied once to get to 2021 and once to get to 2022. There is an additional component to trend for 2022, a one-time adjustment for what we are referring to in these hearings as the COVID rebound. In 2020, there was a portion of the year, a significant portion of the year, where consumers were discouraged from going out and getting normal healthcare services, either due to the social distancing or doctors' offices were in fact closed for a while, that caused utilization to be significantly lower in 2020. This is not something that you would expect to be true today with everything open and with the vaccine out, and certainly not something we would expect to be in play in 2022. So we've called this the COVID rebound. This is not additional utilization for COVID in 2022, but returning to normal from the base period of 2020. And PacificSource included a 3.2% one-time adjustment to utilization. This is a nice middle number. We've had factors between 0 and 7% on these filings, so PacificSource again finds himself right in the middle of all the assumptions by carriers, and we had no concerns with this 3.2% adjustment. So put that all together, they put in a adjustment for total trend factor of a roughly 12.5% to get from 2020 to 2022. And in taking a look at that, that's significant in the fact that the company is only asking for an overall increase of 1.3%. So with the trend raising rates almost 6% a year, and we're only seeing a rate request of 1.3, we have to dig a little further into the filing. So we look at the other adjustments that the company has asked for. One of the major components for our filing is risk adjustment. We take a look at the risk adjustment by all carriers, and we, in some cases, we have to make estimates for what the company has asked for, and PacificSource is one of those cases. PacificSource, in their calculation, brings their experience to the market average before calculating their future claims and future premium. And so that risk adjustment amount is embedded into the filing. And the numbers that they have given us are different, it appears, than what has actually come through in the 2020 risk adjustment transfer amount. So I'm going to take a small break from my analysis and ask the company if they have had a chance to take a look at the risk adjustment transfer amounts actual for 2020 and how that might impact their filing.
Yeah, we've done a preliminary review of the results that came out last week. We don't necessarily expect a major change to our filing. The results were in the same direction and a similar magnitude to what we assumed.
And that's what I'm seeing as well. I will certainly follow up with this in SURF with a formal objection so that you can make an official statement on what this does to the requested rates on your filing. But if my calculations is correct, you anticipated a refund in the range of $2 million and got a refund in the range of $7 million, and that is going to have an effect on your or on the base period. But because of your calculation, that may or may not have an impact on your projected. So I'll ask a more formal question on this outside of this hearing. But this is what we would call an open item at the preliminary decision. So I've covered the risk adjustment and COVID. The next one on the list is reinsurance. We've taken a look at what PacificSource has put in for their estimated reinsurance payments for 2022, and it lines up with what we anticipate the reinsurance payments to be, both at a company level and at the total market level, and we have no concerns with the reinsurance totals. The last one I want to talk about of the major components was alluded to in the company's presentation is this CSR load. And the CSR load is a change in the way the pricing is occurring both on and off exchange for the silver plans. If we have members listening to this and concerned by that, I wanted to go through a little bit what this means. The loading in the past, the loading for the cost sharing reduction payments for the silver plans used to be applied uniformly, both on and off exchange. And in 2022, those loads will be strictly on exchange. But what this means is that off exchange, that load has come off. So if you are in a silver plan and you are receiving subsidies, income subsidies, this will not impact you because this is part of that subsidy calculation. However, if you are off exchange or if you are on exchange without subsidies, you may want to take a look at your rates and options because there will be equivalent plans available or similar plans available off exchange at a greatly reduced rate. So please, if you're a member listening in on this, if you think this is going to affect you, contact your insurer, ask these questions, and find the best option for you. It's our intention that this is not something that will adversely impact members. It is more behind the scenes changing where the load is applied. So just wanted to get that statement in there since the company did mention it. And that concludes the assumptions. So when you add this all up, the company has requested for their individual filing a 1.3% overall increase. That was slightly changed by the passage of the new insulin copay requirements on their standard bronze plan has come down slightly due to the change required in the maximum out of pocket, or actually was it the maximum amount of pocket or deductible? I believe the company said deductible. Can you confirm that?
I believe it's the deductible and out of pocket.
Right.
Confirm. Sorry.
Yeah, I didn't want to say the wrong thing and get called on that later when you're right here. All right, thank you. So the deductible has changed slightly, changing the rates, and this is all to be in compliance with the new insulin copay requirements in the state of Oregon. So these adjustments have also been reviewed. They're very minor. So when I talk about major components of the filing, I don't refer to them, but it is a change since the original request. Take a look at that. If you have any questions, let us know. But we are prepared to approve the individual filing as modified for 2022. And I'll take a quick pause and then I'll quickly go through small group. Does anybody have any questions for individual? Hearing none, I'll go ahead and talk about small group. For small group, the company had a slightly different trend, 4.8% for the allowed, but the same overall 6.0% on a paid basis. Same 3.2% adjustment for the COVID rebound. There is no reinsurance on the small group side, so that calculation did not need to be reviewed. We will ask the same question regarding risk adjustment, but by my calculations, the small group risk adjustment was much closer to the original projection. So I do not anticipate any changes there, but we will let the company respond officially on that. Cost sharing reduction load, the silver loading, is something that only affects individual products, so it would not affect the silver plans. And that's all the major components on the small group side. There is also the minor adjustment for the insulin products, similar to the individual side. And once again, we are prepared to approve as modified for the company for 2022. And that concludes my quick recap and the small group findings. Back to you, Ethan.
Thank you, Michael. PacificSource, do you have any additional information or comments you'd like to make at this time?
No, thank you.
All right, we will now take any public testimony. Please unmute and introduce yourselves. All right, sounds like no one has signed up to testify, so let me remind anyone listening that July 7th is the last day for public comment. Comments can be submitted through our website, www.oregonhealthrates.org. Thank you, and that concludes today's hearing.